Yeah.
So we'll just start our class. And good
I'm
morning,
turning on my
students.
camera, okay, after I'm doing something right now. But
No,
I'm listening.
no worries. As long as once you're done, leave your camera on and then you can um, answer the questions as well.
Okay.
I think I don't know what's wrong with our another student, Pema. She's normally here, but today she's not here, so that's. Were you guys able to do the yesterday's workbook sheet? Huh?
Yes.
Today's topic we have is measuring weight. Will be this one. Share screen. I don't know what's wrong with Pema today. Is she coming or not? Let's see.
She's coming.
She's coming?
Yeah.
Let's
She's
see.
running a little late, she said.
Okay. Today we are going to do measuring height, weight, and vitals, which is very, very important part of our job. When we, the reason why we measure the height and weight, especially is when your nurse or when your doctor has to prescribe medications, he or she prescribes it based on the weight of the person and the height of the person. People, clients, residents who are on medications like warfarin, which are all blood thinners. Blood thinners are given according to the weight of the client, and some of the medications, cholesterol meds and all, they are being given according to the weight. And we have to check their height as well, just to know what their BMI is, body mass index is. Are they obese? According to their height, what the weight should be. The ratio to height and weight is called body mass index. That's when we get to know whether a person is obese, is moderately obese, or over obese. And to check the weight, we prescribe medications according to the weight of the client, weight of the patient. Vitals are very important. Unless we don't know the blood pressure, we don't know the parameters of our blood pressure, pulse, and our SpO2, we will not be able to prescribe any medications, especially blood pressure meds. If we do not check the vitals, we cannot give them medication, especially at the hospital. At the residential care and home care, you do it once a month, only once a month. But when it comes to your acute care, you will do it every day, twice shift, means in a day twice. One in the morning, one in the evening. Okay. So measuring weight and height. Measuring weight and height. Weight and height are measured on admission to the agency as direct. When your client is admitted in a facility, the right away they take the weight of the client and they take the height of the client. When they get admitted in the hospital, they do we do get to measure their weight, but we also do it if new medications are prescribed. Balance beam scales, chair scales, lift scales, wheelchair scales, and digital scales are used. We also have bed scales. What we do is, if a patient is a total care, we put the patient in a ceiling lift. On a ceiling lift, we put the bed at 0 and then put the client on. That's bed scale. Balance beam scales, chair scales, we have chairs. Everything we put 0, we ask the client to sit and stand on them on different scale, and we do the weigh. Depends on how is the mobility of your client. Okay. See. So this is this is for those who are stable or can stand. We just stand. Even if it's one person is sick, we stand by the person. Measuring height and weight. Follow these guidelines. The client only wears a gown or pajamas, which they always do. The client voids before being weighed. If a urine specimen is needed, collect it at this time. Not mandatory that this thing will happen. It happens once in a while that they need to urinate, or we ask them to urinate, because if it's not inside, sometimes it's in the hallway, we don't do that. Privacy and confidentiality. If the weighing machine is in the room and you ask them to stand, yes, could be. But if your client is in the hallway and you cannot move the weighing machine, some of them are plugged in for electricity, then they will work. They're not electronically charged. Then we don't do these things. Please make sure whenever you are doing things, sometimes our book says things, yes, because they don't know where and how we are working. You have to work according to your situation where you're working. If you're working and you're weighing someone in the hallway, would you do that? No. Think of confidentiality. Privacy. Weigh the client at the same time of each daytime. Yes, that's true. We always weigh the client at the same time, same day. Like normally, if it's once in a month or twice in a month, same day, but same time as well. Use the scale for daily, weekly, or monthly weights. As I mentioned, it can be daily, it can be weekly, it can be monthly weights. So if it is weekly, every Wednesday. If it's monthly, it will be every first or last of the month. And if it's daily, every morning or every evening. Balance the scale of 0 before weighing the client, and then record the weight in kilograms. Sometimes your machine would not say kilograms, it might say pounds. We have to change kilogram to pounds. And if anything needs to be changed from kilogram to pound, it is either, if it's kilograms to pounds, you multiply it with 2.2. If it's pounds to kilograms, you divide it by 2.2. 1 kilogram, 1 pound is 2.2. So you would multiply kilograms to change it in pounds, or pounds divide to make it kilograms. Okay? Vital signs reflect the function of 3 body processes essential for life. 1, regulation of body temperature, which is very, very important. 2, breathing, SpO2, and heart function, which is our blood pressure. So when we talk about vitals, we talk about the patient's temperature, patient's oxygen saturation level, and we also talk about blood pressure. You might be saying, hey, why do we need to know about all these things? Suppose if you have no idea about the vitals, would you be able to, during providing care, would you be able to judge what's wrong with your client? No. If you touch a client and you don't know how much you feel he or she is warm, you go and check the vitals. In some, as I mentioned, in hospitals, you do vitals now. Let's say you're in the hospital, working in a hospital, and you check, this client is very, very hot. I will not put the blankets on him. Let's remove the blankets. I'll check the vitals and I'll let the nurse know. But when you don't know what are the numbers, what are the parameters, would you be able to discuss? No. You might not be able to. You would see your patient is, or your client is huffing and puffing. You go get the saturation saturation machine. You'll put the SpO2 on his finger. But when you don't know what the numbers should be, you see 95, you see 91, or you see 87. You don't know what it is. What would you do with it? At least if you have an idea, yes, the normal vitals are like this. The patient's blood pressure should be around 120 over, between 110 to 120, and then the diastolic should be between 80 to 90. The temperature should be around 36.6, 36.7. It's even okay up till 37. And the SpO2 should be, even if it's 96, 97, it's okay. You do have an idea of what is going on with my client. If the numbers are not what I know, you would definitely ask your nurse, hey, I tried to do this. This client was not doing well. I feel like you should come and check. If you see your patient is very warm to touch, he's sweating, you would definitely ask your nurse, this patient is very warm to touch. She or he is very sweaty. Think of his blood sugar might be going down. Think of he has some infection. We right away remove all the blankets. We get them some ice chips and some cold sponge. We'll put it on their head to make sure the temperature goes down. If your client says, I'm feeling dizzy, normally she's not, you can always go and check the blood pressure. Maybe the blood pressure today is going low, and that's the reason he or she is feeling dizzy. That's why we want you to know. We don't want you to know the numbers, learn the numbers, but at least know what is connected to what thing. Dizziness is connected to the blood pressure. Your patient is not able to breathe properly. He or she is huffing and puffing. It could be, we should check the pulse. We should check his respiration. You can ask. The 4 vital signs of the body functions are temperature. If the temperature is very low, I would again repeat, I know it's not for you, but just to keep it in mind, a very low or a very high temperature is a sign of sepsis, which is an emergency. Temperature, pulse, respiration, blood pressure. Some agencies also consider oxygen saturation, which is SpO2, to be a vital sign. Yes, that is also a vital sign. We need to know the saturation of a client. A person's vital signs vary within certain limits. The thing is that every person has their own vital parameters. Yes, generally we say it should be 110 to 120 over 80 to 90, but some people, their blood pressure is always low. It doesn't go. Myself, my blood pressure is always 90 over 60. That doesn't mean that's my baseline. So we call every client, every patient, every resident, wherever a person is, has their own baseline vitals. Anything below their baseline vitals or anything above their baseline vitals is unknown.
Bima said the link is not working. She said she can't log into it.
Let's stop. It's not working for her. In the morning it happened with me also. So, हेलो अस्सलाम वालेकुम जी ये पीमा so person vital signs they vary. We always have to make sure there's a baseline. Anything below the baseline or anything above the baseline would be something which we have to look into, which is a trouble. When your client is in the hospital, we know we do it. But when your client is in a residential care, again, or in a long-term facility for convalescent hours, what we do is we check their baseline. We make the first reading as their baseline. Every month or every weekly when we do, those becomes their baseline. We look at it, oh, yes, last time it was this, now it's almost the same. So this is how we get to know the baseline of the client. And suddenly, if the client reports of anything, let's say I'm short of breath, I'm feeling chest tightness, we do the vitals, we check it. What is the baseline? Because we don't remember, we don't know, or you might be new to this person can be new to you. We just look at his previous record and we see, yes, there is a sudden jump or a drop in his baseline, and we report it. Vital signs, they are measured to detect changes in normal body function, tell about the responses to the treatment, often signal life-threatening events are part of essential process. Again, when we talk about these vital signs and we say that these are these detect the changes, if your client is having a heart attack or is having issues, they have AFib. AFib is one of the diseases in the heart. What happens is the pulse does not stay same. It either goes fast, either goes slow. Based on that, you would be able to detect if your client is saying, I feel my heart is beating fast. You go, you check the pulse is fast. Yes, this client is a patient who is having AFib. You report it to your nurse. Could be they check the blood pressure, it's very high. He or she might need to go and see the doctor. If they have, good morning, welcome, my dear.
Good morning, ma'am.
Yeah, if ever this client he has a pacemaker and you check the vitals, the pulse is very low, maybe the pacemaker is not working well. So that's why we need to know about this vital signs. We need to know how vitals work, what vitals do for us. Yeah. Vital signs, they are measured when medications affect the respiratory or circulatory system. Another thing, let's say you got a client, he's already with you, you know everything about him, but we started this patient on a new medication. We don't know how this medication will affect. What is the effect of this medication? Is it working? Is it really not working? So to make sure whether it's working or whether it is not working, we again take the vitals of the client. So this is another reason why we do take vitals. Some medications, some blood pressure medications we give to our clients. The medication works very, very fast and it brings down the blood pressure. Let's say my client has not been eating very well from 2 days. His blood pressure, would it be high? No. He's not drinking, he's not eating. It will drop. When it's already dropped and on top of it, we are giving him This sensitive blood pressure medication, it drops down, way too down, and your patient can have a fall. Reason saying, that's why some medications need to be, before we give them, we need to monitor vitals. I don't know whether you guys are familiar. There are medications like metoprolol, bisoprolol. If we have to give them, before giving them, we always check the blood pressure, just to know that, hey, where the blood pressure is. If I give it, could be it will go too down. It will shoot down to a very low number where it would be a trouble. So why not to check the blood vitals, and then we do give digoxin. Digoxin is a medication, a blood pressure medication that works faster, and it works. So we have a parameter for it, the apical pulse, the heart pulse, not the regular pulse. We check the apical pulse for that. It's not for, you don't do apical pulses, but just I'm telling you, if you come across pulse, we have a regular pulse, we have an apical pulse. Apical pulse, you have to count manually. You don't do it with a machine. Okay. When there are complaints of pain, dizziness, lightheadedness, feeling faint, shortness of breath, rapid heart rate, or not feeling well. When do we measure vitals? When there's pain. When your client says he's in pain. If he's in pain, his vitals will be very high. If you are in pain, you keep moving, you will move, your heart has to pump more. That's when dizziness. If you feel dizzy, your blood pressure would be low. Lightheadedness, same thing, low. Feeling faint, your blood pressure will be again low. Shortness of breath, your respiration, your SpO2 should be low. Rapid heart rate, your pulse will be high. As dictated by the client's condition or stated on the care plan or doctor's orders. Yes, again, we do not do vitals for everybody. A person, as I told you, mentioned to you many times about MOST. MOST is a directive that tells us what to do and what not to do for your clients. If your client is DNR-C1, do not resuscitate C1. You do not even do vitals for them. That means this is comfort care. Clients who are dying or who are not dying but are on DNR-C1, we do not do vitals for them. We leave them the way they are. Anybody who is on dying, called active dying protocol, EOLS, end of life care. The other name of active dying protocol is EOLS. You would see a butterfly outside the door. That's when we don't do vitals, no matter what it is. And people who have already done their advanced care, and in their care plan, when we check here, what's the most of this patient? DNR-C1. With DNR-C1 people, we do not do blood pressures. As instructed after the client has been given medication to relieve a fever. If your client is having a fever, we check their temperature, which is again, we are taking a vital. We give the medication, we check the vital again. Did the blood pressure, did the fever come down or not? It does not matter, you have to do all the parameters. No, you only might need sometimes temperature to be checked. Okay. Vital signs show even minor changes in the person's condition. Accuracy is essential when you measure, record, and report vital signs. Yes, when you are doing vitals, it's important to report accurate. It's important to report the condition of the patient. If I am walking, let me give you an example. If I'm walking or you walked me up to the bathroom, you brought me back, I am an elderly, my heart will have to work much more than when I was at rest. A blood pressure measurement reading while at rest would be different Then the blood pressure reading while you walked me up to the bathroom and brought me back to the bed is different. So it is important as well to know whether the person is standing, resting, what and when it has been taken. When we talk about vital signs, sometimes you would see your nurse will say, you know what, can you assist me? I need to take ortho vital signs. Ortho vital signs mean the nurse will let the client lie down in the bed. She'll take a reading because this person is at rest. Then she will bring that person sitting up. Sitting up, she will do the vitals. The last, she will ask you, would you mind helping me to stand this patient? We'll stand the patient. We'll take the vitals. Just standing. Ortho means lying, sitting, and standing. Those are called ortho vital signs. The difference between vital signs and ortho vital signs, same time you allow the client first to lie down, then to sit up, then to stand, and we take the measurements. When we see the reading of this measurement, if it is very different, more than 10 numbers, like let's say 10 degrees, when I was sleeping, it was 120/10. When I was sitting, it was 121/10. But when I'm standing, it's 140/10. So it's more than 10 mmHg, which is where they get to know why this client is having an issue. Maybe with dizziness, maybe with headache, maybe with... So there's a problem. You might not be doing it, but your nurse might do. She'll ask you, I need to do orthovitals. Would you mind helping me? So you know orthovitals in your brain. Oh, she will lie him down. Then she'll ask him to sit up. Then we have to stand this client. Report the following at once. Any vitals that is changed from a prior measurement. Anything that has changed from the reading before, if there's a change in any of the four ones, whether a blood pressure, whether a pulse, whether a heart rate or a respiration, or whether temperature, or the fifth vital sign is the SpO2. If any changes, you need to report. Vitals signs above the normal range, vital signs below the normal range. I told you there's a baseline for everybody. Everybody's baseline is different. And with aging, it again stays different. If a person is normally, oh, I am hypertensive, whether no matter what I do, I take medication, but it's around 149/90, you cannot change it. Then the baseline becomes 149/. If anything goes beyond, below or above would be a problem. Body temperature is a balance between the amount of heat produced and the amount lost by the body. Thermometers are used to measure temperature. When we talk about temperature again, we have to always report whether this temperature was being taken orally under the tongue, whether it was taken rectally, did you put it in the rectum, whether it was done axillary in the armpit, or whether it was taken tympanic here. So every site temperature varies. A 36.6 by mouth is not the 36.6 axillary, rectally, or tympanically. So then you are taking blood pressures. You have to make sure where the site is, where we took the blood pressures. You have to write down 36.6. If it's axillary, you will write AXI. If it's orally, you write O. If it's by rectum, you write REC. And always tympanic for TM. You get it, you put it here, the probe, and then you get the... Our body, again, our body core temperature. The body has a core temperature. It varies. The core temperature means the whole body temperature is different from every organ. Sometimes you will see your head is so hot. Are your hands hot? No, not mandatory. Temperature sites are the mouth, rectum, axilla, and tympanic membrane. Each site has a normal temperature range, and as I mentioned, every site of the body has a different. So we are looking at the core temperature. That's why for us, normally we take oral, or if oral does not work, we take axillary. Temperature sites are mouth, rectum, axilla, and tympanic membrane. Each side has a normal temperature range. Always report temperature that are above or below the normal range. We know that. We've seen that. Types of thermometers used. Electronic thermometers, which are battery operated. Some have oral and rectal probes with disposable covers. Tympanic membrane thermometers. Always remember, wherever you work, we always have thermometers that have disposable cover, even if it's oral. No matter what it is, we always use probe thermometers, and they have disposable covers. Otherwise, they will not work. It's a long stick. It has a cover. It goes under the mouth. It goes in the axilla. The only thing that is this tympanic membrane one, it doesn't have a cover, or it might or might not. We have to wipe it with a cavi wipe. DOT matrix thermometers. You have seen nowadays we always use ding ding ding. It gives you a temperature. During COVID, if you see anybody going in, the family members going, they first check the temperature of the person. Temperature sensitive tape. Glass temperatures, thermometers considered safely hazard and non-real. We don't use these glass thermometers anymore. Might be we use it at home, but in hospitals or in any residential care where you work, we don't use them. We only use electronic or battery operated. One, which is battery operated, the small ones, or we use the machine operated, which works on electricity charges. Support workers are not authorized to take rectal temperatures. I told you, you guys will never do rectal temperatures. You only do either axillary or you do the oral or the tympanic one. You never do. You're not authorized to do rectally. Even some nurses are not allowed to do that. Pulse. The pulse is the beat of the heart, felt at the artery as a wave of blood passes through the artery. If you put your hand on your wrist, use one hand, and then you put it over the top of your thumb, just a little below, you will find a pulse. You will see there is a pulse that, and we count that pulse. We do have to know that there are various pulses. This is called radial pulse. We also have carotid pulse that are present here. We don't check both at one time because we might choke the person. We always put our hand and you will see. You can check on your neck. Then we also have apical pulses. Apical pulses are always felt near the tip of the heart. Apical pulse we either do when we are doing a CPR or when we are giving digoxin medication. But because you will not be doing medications all the time, you don't do this. We have femoral pulses, which is in the groin. We do also have brachial pulses here. So we need to know the different types of pulses. At the back of our calf muscles, we have popliteal pulses. So our pulse can be felt at various sites in our body, but you only do one pulse. That is a radial pulse, which is at the wrist. Okay. The pulse is the beat of the heart felt at an artery as a wave of blood passing through the artery. Pulses site: the temporal, carotid, brachial, radial. You only do radial ones, please. Femoral, popliteal, posterior tibial, dorsopedis, that is in the feet. Pulses are on each side of the body. The radial pulse is used most often. We always do radial pulses. The carotid pulse is taken during CPR and other emergencies. If a person gets into a code, is in an emergency, and we are doing a CPR, we always check the carotid pulse. That is the first pulse we can, because the other pulses can be faint. The blood cannot flow to other organs right away. Blood has to flow from the brain to other body parts and from other body parts to the brain back. That's why the first pulse and the strongest pulse we can feel is the carotid, which is done during CPR. The apical pulse is felt over the heart. You don't do that. The pulse rate is the number of heartbeats or pulse felt in 1 minute. And how do we do it? We always count the pulse for 1 whole minute. Now, I will tell you another thing. Sometimes you can check and verify. If you do first for 15 seconds, then for other 15 seconds, check. That's how we say, is this regular or non-regular? The first 15 when you get a number, then the other 15 when you get a number, it should correlate same, add same. At 60 to 66, 60 to 70 is the pulse. If in first 15 you have 30, then you have 15, then you have 10, it means the pulse is not regular. But if you take the first 15 seconds and then second 15 seconds of same, yes, he has a regular pulse. Most often, we only take 30 seconds because we see the first 15 and the second 15 are same. That means this person has, if you're running and this is normal, we only check for 30 seconds and we get to know, yes, pulse is regular. Oh, it's already 33, the next would be 33, his pulse is 66. The good practice is to take the pulse for whole 1 minute. But how we check whether it's regular or non-regular? It's irregular, not non-regular, sorry, irregular. The reason we check for 15 seconds, then 15 seconds. That's how we know. If it varies between the seconds, that means the first half was more, the second half was less. There's something wrong with the pulse. The rate varies for each age group. Kids, their pulse rate is higher. Older adults, their pulse rate is low. And then the middle age group, their pulse is high, but not as high as kids. The highest pulse rate should be of kids. It's always more around 110. That's even normal because they are always running here and there. They have a good flow than any other. Their heart beats faster than normal. Even though I am not an elderly person, I am not in the age group of 70, 75, but my pulse rate can be high or low. Depends on what underlying condition I have. If I'm suffering from any disease, my pulse can be low or can be high. Again, even though we have a certain parameter for an age group, it does not mean that it would be same for all. It also varies on what the condition of the person is. What is the underlying disease of the person? What is the weight of the person? If I am obese, I'm not able to move, will my blood or would my blood pressure or pulse will be the same as this 50-year-old of the other age group? No. So if it is the same age group, but it still can vary with the condition of the person. We don't look at only one. This is the age group. Okay, it should be the numbers. No. Each person is unique. I might have different conditions, my disease. I might have any other underlying disease which the other person might not have. The adult pulse rate is 60 and 100 beats per minute. It's between 60, 66. Report abnormal pulses to the nurse at once. Tachycardia is a heart rate of more than 100 beats per minute, and bradycardia is less than. If you see somebody's pulse is less than 60, they have bradycardia. And if somebody's heart rate is more than 100, they always say this person is tachy. You don't use the whole tachycardia, he's tachy. That means his pulse is above 100. Again, please make sure it can be normal for a person to person because of their condition. Rhythm and force of the pulse. The rhythm of the pulse should be regular. An irregular pulse occurs when the beats are not evenly spaced or beats are skipped. So that means in the 15-second one, if you see the beat is faster than the beat is low, my numbers, that will tell you, I told you, that tells us the rhythm of the heart. We do the pulse for 1 whole minute, but we do it in quarters, or we do it in every 15 minutes. That tells us whether we have the same numbers, it is going even, or is it going irregular. If you put your hand on your wrist and you try to check your radial pulse, sometimes when you put your hand, you would see, oh, it is beating normal. Then in the second phase, it's beating faster. Or it's sometimes 1, then 2, 1 and 2. It's like irregular. You can feel it as well. Even if you don't look at the clock, but if you put your hand and it's regular, which is irregular, visibly irregular, you put your hand on your thumb and you see, oh, now it's faster, now it's slow. Sometimes people have conditions like that. If it's just like fast then goes slow, fast then goes slow. So you will be able to see that. Force related to pulse strength. A forceful pulse is described as strong, full, or bound. Hard to feel pulses are described as weak, thready, or feeble. Again, if it's a forceful pulse, it will be strong pulse. We say pulses are strong, pulses are present. You might also hear radial. Again, radial pulses, the foot pulses are also important. We need to check those ones, but you don't do it. It's only for nurses. Those pulses, when you are checking for somebody's radial pulse and it's very weak, you will have to put a lot of pressure. Then you might get then you might feel a pulse. You say that pulse is weak. It's a thready or a feeble pulse. Weak pulse. Electronic blood pressure equipments can count pulses. Yes, we do not check pulses manually nowadays. We have machines, electronic machines that do pulse automatically, but Just for your information, you can always double check it by putting a hand and counting for your numbers. As I mentioned, count it for 15 seconds, multiply it times 4, because in a minute, how many times are the 15 minutes? 4. So it should match the numbers that you have on your electronic machine. Electronic blood pressure equipments can count pulses. They do not give information about pulse rhythm and force. It cannot tell you whether it's regular or irregular. It only gives you number. So when you put your hand, it tells you regular, irregular. You need to feel the pulse to determine the rhythm and force. You have to put your hand on the radial pulse on the wrist to know whether it's regular or irregular. Pulse oximeter, a device that measures both the pulse rate and the oxygen level in the blood. Placed on the client's index finger, expressed as percent or SpO2. Again, it will vary. Some people, their hands are cold. When your hands are cold, it means the blood circulation is not proper. Or some people have cold, they have this, it is again a disease. They have cold extremities. That doesn't mean they have cold extremities, their pulse is, it will be low. They have that the oxygen saturation is low. No, you always rub their hands a little bit, or the finger. You would put the probe on. Some probes are so sensitive that they cannot read if they do not find a good temperature of the hand. You might switch it to the other finger. The other thing is, these pulse oximeters are also very sensitive if you have a nail polish. Some clients, some patients, they have nail polishes on, and we put the oximeters on them, it can't read it properly. It will give us a number, but it might not give us an accurate number. If it's an emergency one, and a person is crashing, is in a trauma, that time we do not take chances. It could and could not be, we put nail polish removers and we remove the nail polish. Otherwise, for us, if it's 94, 95, it's okay, normal. People who have asthma, people who have COPD, lung diseases, their saturation level should be between 89% to 92%. The reason we check SpO2 is, what is the oxygen saturation of a person? That means how much is the capability of a client, how much oxygen is the blood carrying. Those who have asthma, those who have COPD, they do not breathe much oxygen. Oxygen will kill them. They live more on carbon dioxide. That's why we do not put, for everybody you can give oxygen. For asthmatic, for COPD, we do not put directly oxygen. If the saturation is between 89 to 92 or 93, that's good. That means they're good. You don't give them any. If for a normal person it's 93, you will have to put oxygen. You might help him with some 2 liters or 1 liter. But with a COPD patient, no. Their oxygen carrying capacity in the blood is low. Their capacity of blood is more when it comes to carbon monoxide, CO2. Carbon dioxide, carbon monoxide. They do not, they really tend to be having more carbon dioxide in their body than oxygen. That's why we say, if you have seen, some people are blue and some people are pinkish. If you are pink, your oxygen level is good. If they are blue, that means that body carries more of carbon dioxide than than oxygen. They are COPD patients. Respirations. Count respirations when the person is at rest. Position the person so you can see the chest rise and fall. How do we check the respiration? We see how many times the chest is going up and down, up and down. When you breathe, your chest inflates, exhale, inflate, exhale, inspire, exhale, inspire, and you see there's a rise and fall in the chest, rise and fall in the chest. So you count this rise and fall. The person should not know that and you don't tell the person that you're counting. If you tell the person, they might hold their breath. So you just randomly, when you're taking vitals, look at their chest and you see they don't know. Count respirations right after taking a pulse. Once you're done taking the pulse, then you count the respirations. Keep your finger or a stethoscope over the pulse site. You don't have to do this. It's not all of you. Only some people who will be trained with this condition need to do. Not every day you do it. We only teach this just because some of you might get become trauma carriers. There's a trauma, there's a CPR going that time, you might do respirations. Otherwise, you're not supposed to do it. To count respirations, watch the chest rise and fall for 30 seconds and then multiply the number by 2. You will get the abnormal result. Count for a full minute. If you get abnormal results, yes, you count for the full. Normally, the respiration should be 16, 18. It can even be 20. That is highest. We don't go more than 20. You need to report it. 16 to 18 is normal resps. Healthy adults may have 12 to 20 respirations per minute. It again depends. In a normal human being without any disease, without any problem, we will say 16. 12 to 20 is again low baseline and high baseline. The highest baseline we can go is up to 20. The lowest baseline we can go is 12. Blood pressure is the amount of force exerted against the wall of an artery by the blood. Blood pressure is controlled by force of heart contractions, amount of blood pumped in each beat, how easily the blood flows through the blood vessels. The heart is pumping blood during systole. The heart is at rest during diastole. You don't need to know too much. You only remember when our blood is flowing, we say in a systolic, the blood is moving to all the organs. When our heart is at rest, blood is coming from other organs to the heart, is diastole. A systolic blood pressure is the amount of force needed to pump blood out of the heart into the arterial circulation. Diastolic is the pressure in the arteries when the heart is at rest. Don't worry about it. Blood pressure is measured in mmHg. We always say millimeter of mercury, mmHg. 180, let's say my blood pressure is 110/80 mmHg. When it comes to weight, it can be, my weight is 70 kilogram, or it can be, if I have to change this, it can be 144 pounds. Always pounds is more, kilogram is less. To change kilogram into pound, we multiply it with 2.2. Change pounds into kilogram, we divide it by 2.2. The systolic blood pressure is recorded over diastolic pressure. Systolic blood pressure is the upper one, upper and the diastolic is always the lower parameter. So the systolic blood pressure normal range is between 100 to 140 mmHg. Diastolic blood pressure is 60 over 90. Let's say I told you my blood pressure is 90 over 100. That means the upper one that I said 90 is the systolic one, over 60 or 70 that I said the lower reading is my diastolic reading. Always the upper number is the systolic pressure, the lower number is the diastolic pressure. Hypertension is consistent blood pressure that is more than 140 over 90 mmHg. We say a person is hypertensive, has hypertension means high blood pressure. That means he has high blood pressure if his blood pressure is more than 140 over 90 mmHg. Again, 140 means the upper one, systolic one, diastolic reading is 90, the lower one. Hypotension means when your blood pressure is low. Hyper means high, hypo means low. Anything you would see hypo will lay low, hyper high. Hyperglycemic means his blood sugar is high. Hypoglycemic, his blood sugar is low. The term hyper means high. Hypo means low. Always remember it. I'm hypoallergic and I'm hyperallergic. I'm highly allergic to this. I'm not really allergic. You will see some wipes, some medications creams say hyperallergic if you are hyperallergic to this. Or if hyper always means high. He's hyper energetic. His energy is very high. Hypotension is blood pressure that is less than 90 over 60 mmHg. Normal blood pressure is below 120 over 80 mmHg. You need to report the following blood pressure measurements. Any systolic blood pressure measurement at or above 140 mmHg, a diastolic pressure at or above 90, a systolic blood pressure below 90, or a systolic blood pressure below 60. You don't have to do blood pressures, but if you are working in trauma, you will do the blood pressures. That time, remember, anything which is higher than 140 or anything lower than 90, you always report. A stethoscope and a sphygmomanometer are used to measure blood pressures. Stethoscope, we hear from it. You guys know what the stethoscope is, right? The stethoscope is always used to listen, and a sphygmomanometer is the one that we put the blood pressure cuff. That's called sphygmomanometer. It can be, again, we do not use manual ones. We always use electronic ones at our facilities and hospital, but sometimes we do have clients, we have issues with clients, nurses have issues with clients. They cannot get a proper reading of their blood pressure because of again, these machines are sensitive. That time we use manual ones. Put the charger on the charger is the wrong charger. I'll get the charger. Just give me one. So always remember, we do use We have two types of sphygmomanometers. One is electronic and the other one is manual. Manually, we do when we do not get a proper reading and we feel like the blood pressure cuff does not read. It says COX. That means either the width of their arm is too much up, or biceps is too much, or sometimes it's too thin. It can't read. With kids, if you see in Walmart shoppers, there are machines, they say less than this age. Does it mean that we can do less than the age of 4, 5, 6? We can do blood pressures? No. We use special machines for them. We use manual machines for them. The sphygmomanometer has a cuff and a measuring device. The following types of sphygmomanometers are used: aneroid type, mercury type, and electronic type. Blood pressure is normally measured in the brachial artery. Yeah, as I said. Check with your employer if you're expected to measure blood pressures. Again, it's only if your employer has trained you for a specific reason, otherwise you don't do blood pressures. Not even in hospitals every day you do. It can be a specific trauma social support worker, otherwise you don't do. Stethoscope, an instrument used to listen to the sounds produced by heart, lungs, and other body organs. One used to measure blood pressure, cleaned well between use on clients to prevent spread. If we use on one client, we do not use it on the other client. We always make sure we always clean it between each client. Pipe the earpiece and the diaphragm. The round thing that you see in the front is called a diaphragm. With antiseptic wipes before and after use. Warm the diaphragm. Yes, we always warm the diaphragm, that round thing, before we put it on the client's chest because it can be cold. Place the earpiece tips in your ears with the bend of the tips pointed forwards. Again, if you ever try it, if you do put it, the bend should be forwarding outside. If you put it inside, you will not be able to hear anything. Okay? Place the diaphragm over the client's brachial artery and hold it in place. Prevent noise. If you are in a noisy area, you might hear the noise through the diaphragm. So always making sure it's placed stable. Put a finger or two fingers on top of it, but you don't have to do it. We need to go through this. Measuring blood pressure is delegated act in some workplaces. So always, I told you, it's a delegated act. You might not be doing it all the time in specific times. If you are expected to take a blood pressure, ensure your employer allows you to perform this procedure. The procedure is in your job description. You have received special training, again, otherwise you will never do it. You have received the procedure with a nurse, and a nurse is always with you when you did it before. A nurse is available to answer questions and supervise. This is what we have for today for this. Any questions with this chapter?
So you were talking about how we're gonna like listen to their heart and like check the blood thingy. Say we're taking blood, like if we're gonna take any blood, do we need to use like the bands that like you tie on them to find like the vein?
No. The band that you tie on the vein is different. And this is different. It's like a cuff. It's like it's just like this. A band. It's open. You get it. It's same broad as much. It's called a cuff. You apply it like this.
The blood
Yes. And then you attach it with this. These Cuffs, again, if ever you are taking blood pressures, you also have to check the size of the cuffs, whether it's a small. If your client, let's say my arm width is small, and you put a big cuff on me, blood pressure reading will again not be correct. Those are called cuffs. It's a band. It's wide. This band we put on the arm and then we attach. Very small, small, adult, extra large. People have so we put those bands. The one that you are saying time, that's not the same thing. That's to collect blood. When we draw blood, we're not drawing blood, we are checking the blood pressure for blood pressure check. We have a cuff, we put the blood pressure cuff on, we connect it to the machine, the machine gives us a reading. Then there's a probe. It's like opening a mouth, like a duck mouth. We put it on a finger and then it gives us a reading. It has a red light. When the red light beeps on the nail bed, it gives us a reading about what the saturation level is. Okay. Any other question? No? Do you want to first go for your break and then when we come back, we will do our workbooks? Okay. We'll be back at 10:30.
Yes,
ma'am.
yesterday I called the office and then they told me to come today for the book, so I couldn't get yesterday.
It's okay, no worries. You'll get the workbook today, but
Yeah.
you will mark your answers. No problem. Thank you.
Ma'am, what time should we come back?
She said 10:30.
Oh, okay. I will go and have breakfast.
10:30, my dear. I'm here. I was just looking at your book. 10:30 will be back.
Okay.
Okay. What else? Mm, Everybody is back? Okay. Let's do the chapters now. Caring about culture. People of all cultures are comfortable with physical touch.
False.
Very good. False. In Western countries, personal space is about 120 centimeters, 4 feet.
False.
False. Silence. Good. Silence can be a sign of respect in some cultures.
True.
True. Some children rebel against the culture and their patterns, their parents.
True.
True. You should never try to convert your clients to your own belief system.
True.
True. All traditional remedies are harmless. False. Discrimination leads to prejudice.
False.
False.
In some countries, in some cultures, men do not shake women's hands.
True.
True. Culture is influenced by a large number of factors.
True.
True. Asking about your client's belief and values will help or help feel valued and respected.
True.
True. From the above, you have to choose the correct answers. It can be many as well. Culture affects person's belief and behaviors in the areas of
A. E.
F.
Okay. Shamushi, कैसे बचिए इसमें? A, C, D, E.
For number 11.
Huh?
A, C, D, E.
Yes. A, communication. C, family and social organization. D, religion and worship. E, healthcare practices and reactions to illness. What happened? Good morning. Qualities that support social workers should process include. What should it be?
N, B, D, E.
A, B, D, E. Good. The next is many facial expressions that convey emotions are universal. Some of these expressions are to convey. Hold on.
A. Anger, surprise, embarrassment, happiness. A, C, D, E.
No. Good. It is B for pain, C, surprise, D, embarrassment, E, happiness. No A.
Oh, A.
No A. Think of, because it's not from your client only, it is from your side also. Would you show facial expressions anger? No. No A.
I mean, kinda. Not really, but kinda. Look, you can.
Yes, but that's not ethical, right? So that's like an extended family may include.
A,
A,
B.
D, E, F, G.
Yes, A, B, E, F, G. Religions may promote belief and practices related to
Except diet, everything.
everything. A, B, C, D, E, F, G, H, I. To be accepting and understanding for others, you need to understand.
C and D.
B, C, E. How your culture has influenced you, how culture influences clients' behaviors and attitude, and that each client is unique and individual, may not follow every belief and practice. B, C, E.
Are we on 60 or 17?
Yes. 16.
D, D, E, right?
Yes. B, C, E. Ball, cat, egg.
E,
When you communicate with people who don't speak your language, you should
A,
A, C, D, E, F, G, and J.
A, C, D, E, F, I, J. Apple, cat, dog, egg, fish, ink, joy. Apple, cat, dog, egg, fish, ink, joy. Yeah. A, C, D, E, F, I, J. The acronym for LGBTQ2 refers to
A, B, D, F, G, I.
yes, A, B, D, E, F, G, I. Now, multiple choice. People of Asian. Repack is your brother's pencil. People of Asian background may conceal negative emotions with
Smile.
a smile. B. Sam and Chris are a couple who share parenting responsibility for 2 children. Sam is the parent of one of the children, but both Sam and Chris are legal parents of other child. This is an example of
are they like
Blended.
blended family. A. Culture is considered to be more than just a person's ethnicity because
A,
A.
it can refer to characteristics learned by living in any group. Jim is homosexual man who was recently beaten up after leaving a gay bar with a friend. This is an example of
C,
Racism.
no homophobia.
G.
Racism is when it is caste. It is the sex. It's not sexism as well. It is homophobia. Tony's parents came to Canada from Italy. When Tony was 3 years old, he expected him to marry someone who is also Italian descent. However, Tony is seriously dating someone from Asian background. This is a situation of
Cultural conflict.
cultural conflict. B. Correct. A nuclear family consists of
Mother, father. A. Mother, father, children.
yes, A. Mother, father, and children. Come from this. Gail has refused to take her prescribed blood pressure medication because of her religious faith. However, her family would like you to sneak her pills into her, grinding them, adding them into her food. Your best response to the family would be
It would be wrong.
C.
C. It would be wrong for me to,
Client's wishes.
yes. Mrs. Jing, who is Buddhist, would like to pray and has asked if you can pray with her. Your practice is different faith. What would you say for this request?
C, I will support you while you.
B. I will support you while you are praying as long as I'm able. Sue would like to get a job as a construction worker. She was denied because she might get pregnant and require maternity leave. This is an example of
Sexism.
sexism. B. Mr. Jones had asked for a male support worker because according to his religion, it is improper to be touched by a female other than his wife. There is no male support worker to handle this situation. How would you handle this situation?
A,
Speak to your supervisor.
Yes. Speak to your supervisor and He will deal with this. Okay. Matching the followings. Okay. Characteristics of a group of people.
Culture. D.
Culture D. Exactly. An overly simple or exaggerated impression of a person.
Prejudice. B.
F. Stereotype. F. Stereotype. An unfair treatment of people based on their group membership.
G. Discrimination.
Yes, G. Discrimination. The area immediately around one's body.
E. Personal space.
E. Personal space. Group of people who share similar physical features.
A. Race.
A. Race, yes. Group of people who share a common history.
F for group. C.
Pardon?
C. Ethnic group.
C. C. An attitude that judges a person based on his or her membership in a group.
B. Prejudice.
B. Prejudice. Trying to convert clients in your own in your own belief system.
Spiritual abuse.
Spiritual abuse. So the match the followings with D, F, G, E, A, C, B, H. Now fill in the blanks. Culture affects a person's belief and behavior towards
Family and social organizations. Religion and worship, healthcare practices and reaction to illness,
yes,
communication.
communication, family, social organization, religion and worship, healthcare practices, and the religious beliefs. Yeah.
Yep.
Non-verbal clues can include what can the non-verbal cues can be.
Body language, body position, overall appearance, eye contact, tone of
We would say
voices.
touch, if we touch, right? Personal space, eye contact, and facial expressions. I would repeat, touch, personal space, eye contact, facial expressions. How can culture conflict affect an older person?
The last one.
Facial expression. How can a cultural conflict affect an older person?
When their children reject the culture.
Yes, they can greatly get stressed and disappointed
Disappointed
if
when
their children reject their culture. Adopting the tradition of a larger society is called
assimilation.
assimilation. Actively inviting and creating a space for cultural expression within healthcare is practicing
Cultural safety.
cultural safety. So the next we have is chapter 8. Stressors over a short period of time can cause chronic illness.
False.
False. You should get weekly goals for yourself.
True.
True. Getting a promotion can cause stress.
True.
True. A child usually shows different signs of stress from those of an adult.
False.
False. Time management is essential for reducing stress.
True.
True. There is no point in planning your work a day ahead because things change when you get to work.
True.
True.
No, false. If you have, if the, it doesn't mean that there's no point of planning if things change when you get to work. No, you still will plan. What will be my next plan of action for this thing to do? You don't need to report a conflict with a client if it is resolved.
False.
False. In a home care setting, you must plan your time so you can be on time for your next client.
True.
True. Older people are less able to cope with stress than younger adults.
False.
False. All stress is bad for your well-being.
False.
False. Now, multiple responses. Which of the following strategies can help you manage stress in your life?
All except D.
All, yes, all except D. A, B, C, E, F. There's nothing. Hold on. Cut. Which of the following can help you save time and stay organized in order to reduce stress?
All except C.
All except C. A, B, D, E. Which of the following strategies can be used to manage conflict or at work?
A, C, D, E.
Yes, everything except B, A, C, D, E. Which of the following can be physical signs of acute stress?
A, B, E, F.
A, B, E, F. Exactly. No. Emotional and behavioral signs of stress can include which of the following? Go to Baba. He will open it. Emotional and behavioral signs of stress can include which of the following?
All except D.
All except D, yes. Which of the following represents the acronym SMART when referring to goal?
A, C, E, G, H.
A, C, E, G, H, exactly. Which of the following defines anxiety?
D.
D. Just a moment. Which of the following defines projection?
Assigning one's feeling to someone or something else. A.
A. Assigning one's feelings to someone or something else. Which of the following is a physical sign of stress?
B.
C.
C. Sweaty palms. Which strategy will help you manage stress?
B.
B. Developing self-awareness. You may encounter conflict with the client's family members because
C.
C.
C, they do not understand nursing care plan. Don't, please. Don't put your finger. A vague, uneasy feeling, often including a sense of impending danger or harm.
F.
F, anxiety. The emotional behavior or physical response to an event or situation.
Stress. D. Stress.
D, stress. Symptom state of physical, emotional, and mental exhaustion.
A. Burnout.
A, burnout. Exactly. Ongoing stress that can lead to burnout.
C.
G,
G.
chronic stress. Yes. To acknowledge, recognize, or confirm the person's feeling.
C.
C, validate. A type of stressor that is healthy and gives one the feeling of fulfillment.
B.
B, eustress. A clash between opposing interests and ideas.
H. Conflict.
H, conflict. An event or situation that causes stress.
E. Stressor.
E, stressor. So the answers are F, D, A, G, C, B, H, E. Okay? Be quiet. This is gone. Problem solving a process. Describe this process. How would you say?
Identifying and analyzing the problem, finding a solution to the problem, devising a plan to apply that solution.
Yes, you will identify the problem. You will determine whether it requires your attention or not. You would analyze the problem, decide if you can do it on your own or if you want your supervisor to be in this, and then you will devise a plan. Think of a solution which can be practical, whether it's whether we can supervise it or not. What are the common stressors that you may face?
Health problems, loss of spouse, family members, friends, and unfortunately sometimes death of grandchildren.
Yeah.
Economic worries, since a
Yes,
large number
economic
are on
worries,
limited
true.
and fixed income. Increased dependency on another person. Loneliness, isolation, decline in abilities because of aging.
That is absolutely correct. Now, it says when you realize you have a problem at work, when should you consult your supervisor?
When client showing signs of stress, such as loss of appetite or sleep, change in behavior or mood, increase use of alcohol or other substances.
Yes. First thing, if it's an emergency, right? If there's a
Yes.
change in the client's condition or normal functioning. Very true. Then we might also, if your client is ill, if he is in stress, if there's a safety risk, and he's at a risk, if there's a problem involving medications, if the client complains, if there's a change in maybe the diagnosis, condition, treatment plan, or if the family or a client needs something else which is not there, or a conflict between the family members and you guys. So we can always put that in. Then we have what steps should be taken to resolve conflict between two people?
All the things mentioned in box 8.7,
Yes,
page 126.
8.7. Ask the person if you can meet privately. Agreed on a time and place to talk. Meet in private setting when somebody cannot hear you. Explain the problem. You explain the problem by listening, facts, specific behaviors. Listen to the person's response and identify ways to resolve it. If think the person is coming to meet for you, implement the solution, review a situation if needed. So all that's in the table. Next, we are going to do our chapter that we did yesterday, promoting clients' pain management and pain safety sleep. Let's go on to that. And next two chapters and chapter 24 would be today's job. Okay?
Okay. We're doing the promoting clients'
Yes,
comfort
we
and
are
pain
doing
management.
promoting client and comfort now. Everybody there? Okay, let's see. Personal items in a client space are arranged as the individual prefers.
True.
True. The support worker may throw away any items in the client space that are in the way.
False.
False. Make sure the client can reach the telephone, television, and light controls. True. Of course, we will make sure that they can reach it. Moving furniture and belongings may be safety hazard for a client with poor vision.
True.
True. Distraction involves creating an image in the mind.
True.
No, false. Older clients are at a greater risk for undetecting disease or injury because they have decreased pain sensation.
True.
True. Crying, fussing, and changes in behavior are normal in infants and young children.
True.
No, false. Crying is but not fussing and changing behaviors. It can be because they are in pain. It can be they because they cannot express. It could be that reason. Clients from birth to 1 year and clients age 65 years and above will probably need lower room temperatures.
False.
False. From the list above, choose the correct answers. Which of the following are factors that affect pain?
Age.
And you have multiple answers here.
Age, culture, D, B, E, F.
A, B, D, E, F. Past experience. B, nurse pain assess. No, B is anxiety, not nurse pain. A, B, D,
D,
support from
E, F.
others. E, culture, and A, F, age. A, B, D, E, F. The nurse needs certain information to assess the client's pain. Which of the following questions could you ask to help gather this information?
All four of them.
Yes, all. Which of the following are safety measures used when the client is receiving strong pain medication?
B, C, D.
A, B, D, E. Keep the hospital beds in the lowest position. I always tell you, remind you. Provide assistance when the client is ambulating. Check the client every 10 to 15 minutes. Provide a calm, quiet, darkened environment for them to sleep. Which of the following body responses may be sign or symptoms of pain?
B, C, D, E.
A, B, D, E. If you have headache, you might be throwing up. Increased pulse, respiration, blood pressure. Sweating and vomiting. Dry skin cannot be of pain. Dry skin is from dehydration. The call bell should always be positioned
Within the client reach.
within the client's reach. What type of pain is felt suddenly from injury?
Acute pain.
Acute pain. How long should you wait to perform procedures after pain medications are given?
C.
C, 30 minutes. What should you do if a client expresses an intention to leave the facility without the doctor's permission?
Tell the nurse immediately.
Tell the nurse immediately. B. If you wish to locate an item in the client's closet, you should
C. Ask the client permission to
ask the
look for an
client
item.
for permission. You are admitting a new client. Which of the following situations should be reported to the nurse immediately?
A and B.
Both A and B. D. Your answer should be D, both A and B. The client complains of pain and appears in stress, and the client cries and expresses a desire to go home.
B, C,
Huh?
B and C.
No, just D. Your D is A. The D option is both A and B.
Oh, I thought you were on number 19.
Yes. 19. Mr. Smith is being admitted to a facility. She wants a family member to stay with her during the admission process. What should you do?
B,
B and C.
Only C. Because it's the nurse who will do the admission. So understand that this is critical and emotional time for Mrs. Smith and her family. Let her know the family member to stay with them. Which of the following task is a support worker's responsibility when a client is being discharged?
Packing the client's belongings. A.
A. Packing client's belongings. Which of the following statements about pain is true?
B.
B. Pain is different for each client. Which of the following statement describes chronic pain?
B.
B. Pain that may be constant or occurs off and on. Which type of pain occurs when a client with an amputated leg still feels pain in the missing limb?
D. Phantom.
D. Phantom pain. If a client is unable to fall asleep, is unable to stay asleep, or awakens easily and cannot fall back to sleep, the client has which of the following conditions?
B.
B. Insomnia. Absence of mental or physical stress.
Relaxation.
Yes, relaxation. C. Directing the client's attention away from pain.
Distraction.
Yes, distraction.
B.
Creating an image in the mind and focusing on it.
A.
A. Guided imagery. Adjusting the thermostat in a room.
A,
A. Temperature.
A.
Turning lights down during rest periods.
E.
E. Lighting. Emptying bedpans and urinals promptly.
D.
D. Odors. Opening windows and doors and turning on fans as the client desires.
B,
B. Ventilation. Talking quietly to staff members.
C. Noise.
C. Noise. Pain is felt at the site of tissue damage and in nearby areas.
C.
C. Radiating pain. Pain is felt suddenly and lasts a short time.
Acute pain. A.
A. Acute pain. Pain is felt in a body part that is no longer there.
D.
D. Phantom pain. Pain lasts longer than 6 months.
B.
B.
D. Chronic pain. Absolutely. Then is the table for us. Newborns, birth to 4 weeks.
D.
D.
D. 14 to 18 hours. Infants, 4 weeks to 1 year, how long they should sleep.
H.
Age 12 to 14 hours. Toddlers and preschoolers between 1 to 6.
A.
A. 11 to 12 hours. Middle or late school people, children, I mean.
D.
D. 10 to 11 hours. Adolescents between 12 to 18 years.
F.
F. 8 to 9 years. Young adults,
C.
7 to 8 hours. C. Middle age group,
E.
E. 7 hours. Late adulthood,
G.
G. 5 to 7 hours.
They only get to sleep for 5 hours.
Huh?
5 hours? They only get to sleep 5 to 7 hours?
5 to 7 hours. Like it should be, it's the random, they should minimum get this much hours of sleep.
Mm,
Now we will indicate A as a behavior for sign of symptoms of pain and A as related to pain. B, aching.
wait.
A.
Aching is always related to pain. B. It's a descriptive. When somebody says it's a aching, it means it's pain. Because it's not a sign and symptom, it's description of pain. Thrombing.
B.
Again, B. Remember, oh, I have aching pain, I have thrombing pain. It's a description how pain is. Stabbing pain. Remember, I told you yesterday? Grounding.
A.
A. It's people moan and ground. A. Symptom. Restlessness.
A.
A. Squeezing.
B.
B.
B. Knife-like.
B.
B. Dull.
What is knife like?
Like a knife.
Yeah.
Sharp like a knife. They tell you,
Okay.
I have a knife-like pain.
Like sharp pain.
Sharp pain.
Dull is. What is that?
Dull. Both are B. Knife-like is B. Dull is B.
But what is dull? What is that?
Huh?
Like meaning behind it.
Pardon?
Like dull, the word dull, what's the meaning behind it? Like what does that mean?
Dull pain. Like it's mild pain. It's not, if you ask someone, how is your pain? My pain is it's like a dull pain. It's a mild pain.
Hmm.
Mostly we say dull pain if it's in abdomen. You know, which is, I do have pain, but it's not that sharp. I feel like it's a dull pain.
Oh,
It's
like far
bad.
away.
Yes.
Okay.
Irritability.
A.
A. Quietness.
A.
A.
A again. Now, what type of pain is felt suddenly from injury, disease, trauma, or in surgery?
Acute pain.
Bacon?
It would be acute pain because it's a sudden pain, right? How do these factors affect pain? Past experience.
Severity of pain, it causes and how long it lasted.
Yes.
Its causes and how long it lasted.
Past experience will will let the client know what to expect, either how it can help, either how it can worsen, how he can manage the pain, right? Person, even he can get fearful from the past experience. How about anxiety? Anxiety can make a person feel worse, right? can rest and sleep. If not, if the
Lack of rest and sleep, it affects
yeah,
how the client copes with the pain.
so if the person does not rest and sleep properly, they might feel the pain will become worse. Okay, it might worsen the pain. How do we explain how attention will affect the pain?
The more client thinks about the pain, the
Yes,
more
the
pain
more the client
it
thinks
gives.
about the pain, the worse it would become. Value or meaning of pain. Always remember, pain means different things to different clients. They react accordingly. I told you, some of the cultural, they think pain for us is like a curse. Some people think pain for us is normal. Some people think pain for us is because of some bad deeds. So always remember, pain means different things to different clients and they react accordingly. Okay. Support from others.
If not available, they will be increasing in fear and anxiety and suffering.
Yes. If not available, it definitely will become worse. And if family and friends are there, it might become a comfort. It, they might provide comfort and support. Culture.
And degree of pain expression does not correlate with pain intensity.
Culture always again influences clients' pain. Some cultures they feel pain easily. Some of the cultures we don't feel pain easily. Okay. Age.
Multiple health problems that cause pain.
Yes. With age group, it can be multiple problems. Children, they might not, even young children, they might not know how to express pain. Um, we might see some behavioral issues with them. Elderly, they don't know how to communicate. Older people, they have dementia, they may not be able to communicate pain. Again, any behavioral change in them would indicate that there is a pain. Okay. The nurse needs certain information about client's pain. What are the important observations you should make? Location.
Ask the client to point to the area of the pain,
Yes, ask
which
where the
anywhere
pain
else
is,
pain
ask to point it, and ask what the area of the onset and duration.
When did the pain start? How long has pain lasted?
Yes, ask when the pain started and how long it lasts. Intensity.
Ask the client what kind of pain. Please rate from 0 to 10.
Yeah, 0 to 10. Description.
Radiation pain, type of pain,
Yes, so
point
ask him
to
to
the area of
describe the
pain.
pain or what kind of pain they are feeling. Factors causing pain.
So, what the client was doing before the pain started and
Yeah,
when did it start?
yes. Vital signs.
Pulse, respirations, blood pressure.
Yes, pulse, respiration, blood pressure. It gets affected with the pain. Other signs and symptoms of pain.
Dizziness, nausea, vomiting, weakness, numbness, tingling, or other behavior changes.
Very good. Now it's saying why are older clients at a greater risk for detecting disease or injury?
Because of dementia, affects pain perception.
Because they might not feel the pain, because it's severe, they are dementiated, they don't know what to expect. Right? Just one. Next is the nurse asks you to assist with these measures to control pain. What is done with each one? Distraction.
Attention directed away from the pain through distractions such as conversation, music, television, games, and etc.
You can always use conversations, music, TV, and games. Relaxation.
The nurse teaches the client to breathe deeply and slowly to relax muscles. A comfortable position and a quiet room are important to achieve
Yes,
the relaxation.
make him comfortable. Put him in a comfortable position and ask him to, and even make the room quiet. Guided imagery.
The client is asked to think of pleasant scenes, for example, a warm, sunny beach. Use a calm and soft voice.
So even soft music, a blanket for warmth, and you can also darken the room to help him. When the client experiences pain, it cannot be seen, heard, felt, or smelled. How can you know the client has pain?
Change in body language and behavior.
Yes, we can see from the body language, we can see from the behaviors that they are exhibiting. What are some ways that we might be able to tell that infant or young child has pain?
They may cry or whimper and be unable to settle.
Crying, fussing, change in behaviors, unable to settle them down. Ill or injured client need to rest more often. How can we help them to get rest?
Allow rest periods as needed. It is important not to rush the client.
Yes. Do not push them even beyond the limits that we are providing them care. Allow them the rest periods and do not interrupt them during their sleep. What foods or liquids can help a person fall asleep?
Milk, cheese, and beef.
Milk, cheese, beef. How do the following factors affect sleep? Illness.
Awakened were frequently need for treatment and medication.
Yes. Nutrition.
Food and drinks containing caffeine
Yes, they prevent sleep. And milk, cheese, and beef will promote sleep.
and alcohol.
Yes. Environment.
Change in familiar surroundings, example, bed, noise, and lights.
Yes.
Changes in familiar surroundings.
Changes in exercise at bedtime. Right? Medications and alcohol.
Medication for anxiety and depression can interfere with sleep.
Always remember some medications they promote sleep and drowsiness, others
And
interfere
some,
with the sleep, right? When a person is consuming alcohol, they might feel drowsy, and then they might not wake up, they might have difficulties falling back to sleep, right?
yes.
Changes and stress.
Changes in routine, stressful events like new job or divorce, etc.
Yes, anything like that can change and disrupt sleep. Emotional problems.
Emotional distress, fear, worry, anxiety.
Fear, worry, anxiety, depression, it can always disrupt our sleep. What can you do to the client's room to promote sleep?
Take a warm bath or shower. Make sure the client wears loose fitting nightwear. Darken the room. Close the shades, blinds, or curtains. Implement measures to relieve pain.
You make sure the bed linens are clean, they're dry, wrinkle free. You provide them with warm blankets, reduce the noise, darken the room, right? What drinks should be avoided before going to bed?
Caffeine and alcohol.
Caffeine, alcohol. Uh, List ways that a home like environment can be provided in a long term care facility.
Having a bedtime snack, watching a television program, reading a book. Clients may like to check on friends and loved ones before going to bed.
Yes, you might even ask them to choose their furniture. You might place their personal items as well in their room. You might arrange with the family members, get some pictures and hangings, right? Provide them even with a warm welcome. Higher room temperatures will probably be needed by the client in which age groups?
Uh, Infant and old people and people with illness.
Yes, one who are newly born, birth to 1 year, and 65 years and over. Okay, elderly, very elderly. Why are toilets in some healthcare facilities higher than the standard toilets?
Comfortable for taller people
Comfortable for taller people.
like it's getting up is easy from low seat for disabled people. High seat.
People on wheelchairs, it's easy for them to get up. And also, people who might have joint problems, it's easy for them to get up quickly. Okay. So tomorrow you will be doing chapter 24, the one that we did today, and then 9 and 10. Is that correct? Nine, 10, and 24.
9, 10.
Okay. 2 from the back, 1 from one that we did today. Okay. And Pema, you will be able to get your book today, right? Okay, no problem.
Yes, ma'am. I will be going after class.
Yes. And then after we finish this book, I will give you an assignment. Those assignments, 2 assignments, short assignments, and 1 project. You will be interviewing a client who is elderly. It can be anyone from your community, family, or member. I'll give you a description of it. You have time till the end. You will finish and give it back to me. And it should be an APA style. So you will have to get familiar with APA style, which one to use, how we do it. It should not be copied from somewhere, because if I put it into my computer, if it's taken from somewhere, it will show that where it has been copied from. All the plagiarized items, it will show up. So do not copy paste, right? Sometimes they don't know, like if you are taking a paragraph or something from somewhere, please make sure you use a proper APA style. You put it there and you write from where you have copied it. There's a way in APA where it will put it in the commas, and at the end of the project, it shows the bibliography that this portion has been taken from this site, which is not paraphrasing, which is not plagiarism. We do have to put some words from this book. So how do we do? You copy paste, but you write it, note it down. There's a way how to note down these things that would create a column saying numbers. And if that thing you repeat from the same book, it will say 1, 2, 3, that 3 paragraphs have been taken from this book or from this article. So I want you guys to get familiar with APA style. Take 2 days. Take 2 days to look into how to deal with this APA style. If you don't know, if you still need help, we'll help you.
APA style.
APA style. When you write any paper, or you do any any state of scenarios, questions, answers, we always we don't write in Word. We use a format called APA style paper. We call it APA. There's a standard style that is being used all throughout Canada, which is APA style. Whatever course you will take in your life, If you need help, go on Khan's Academy. They show how to do it.
Trans Academy.
Khan's Academy, which is easy way to learn how to create a paper from APA style, how to write an APA style paper. Type Khan's Academy APA style paper. So it will show you how to help. If you're copying from somewhere, how you will notify that I have copied it from this book, I have copied it from this article. You always have to do that. Then after you review it yourself, if you have questions, I will help you. But this way I won't be able to do it. It is your paper, you should be able to, and you can hand this paper to me. I will give you 2 or 3 chances because I know you are doing it first time. If I feel this is not right, I will give it back to you without marking and give you a chance to fix it. That's why I want you guys to learn how to create an APA style paper. Let's see.
Can we have that assignment in this week?
Yes, I will put that thing in this link. I believe it should be on this. I'll send it to you guys. Okay, don't worry.
Wait, but this week, when is it due?
It is due at the end, but do it now, because if you will do it now, then you will be able to, if there are errors, you will be able to fix it. If you give it the last moment, unfortunately, that will be your last chance to, then you will have very less time to elsewhere.
Siblings too, right?
Hmm?
It could be your siblings too, right?
Any older adult, elderly person, anybody, any adult from your family.
Okay.
What do we have to talk to him about? Like,
You will talk to, hold on, that sheet will tell you how you spoke, where did you meet, how did you start your conversation, was it, how did you start up with open-ended questions, then how, so you have to create, in a way, communication style, how you communicated this with this person. If you involve yourself with this person, what was the startup, how he
like,
react, what did you tell, this is how you convince them that I am going to write a paper.
okay,
Right?
and will it be related to his health problems, or it can be
Then
anything general?
you ask him about, how you are dealing with the stress, how you, I will give you, there are questions in this one.
Okay.
I have to only double check, is it now the same scenario they want, or they have changed anything. I would check and get back to you in a moment. Just give me one. Students assignment. Should not be students assignment. It's in your evolve. This course description we did. Role of HCA we did. Activity here. Which one you will need? Healing, and will you do on healing and this, or you will do Personal care. Let's do this one. Let's check this one. Mm. Let me do. Let me do one thing. It will be difficult like this. Once you go on your practicum, you will see the clients there, right? You don't have to choose a client. Then you can write the experience of those clients on an APA style, which is much easier than the way it is asking you to do this. Randomly, it will be very difficult to make sure that you are putting all. Nobody would really give you information about things. So I think it will become difficult. They will not tell you their problems. It's going to be difficult for you guys. So what you do is, once you go on your practicum, we will make sure that you would create a paper describing the components of this, what type of dementia person had, how did you deal with it, what did you do with them. You will deal with everything there. It would be much easier. Let me look into this one more time, and I will get back to you guys. But till then, you see how to write an APA style paper. How is that?
Yep.
Because it is a requirement for you guys to do it, and it contains around 30% of your marks. Logically, it should be a person from outside. It shouldn't be a family member. So you will be able to pick up from your facility, from when you work with them, how this person, what dementia, what level of dementia he had, how you introduced yourself to him. You started working in that facility on your practicum. How did you approach him or her? What measures did you take? Was there any risk factors? What was the most of the client? Otherwise, this way you won't be able to know all the information. You just get to the point where you learn how to write APA style, and then when you go for your practicum, you will write this paper. But I will hand it over to you, this sooner than later, maybe tomorrow or day after tomorrow. Okay. So for tomorrow, do chapter 9 and 10 and the new chapter that we started.
24.
Yes. Okay. Any other questions? I have to check this one. Right. We'll do this. Any other thing I can help you with for today? Anybody has any questions? No? Everybody is good?
Yep.
Okay, then we'll see each other tomorrow, right? Make sure.
When are the approximated dates for the practicums going to start?
I haven't checked with the school. I haven't honestly checked with, because we need to finish first theory. Once your theory is done and your lab, you need to learn things in lab, then it would be around in 2 weeks.
Lab thing?
No,
Or the
not
practicum?
lab thing. Your practicum, actual practicum.
And the lab thing was going to be next week?
Lab thing we will start at the, because this is maybe probably will do lab on Tuesday and Wednesday. No? How about
Wednesday?
how about not this week, the next week, and the coming week, Tuesday and Wednesday, you're not available?
Yeah, I won't be available on Tuesday and Wednesday.
Not Tuesday. Then we can do it Monday afternoon and Wednesday. I will give you a hands up before. How about let's see Friday. Oh, we'll see Monday. We'll see Monday. Definitely Monday we'll do it. Okay?
Okay. Yep.
We might start late, not so early. We will start late on Monday, and then we'll do it for the whole day so that you guys have, and I can hand over some papers to you guys so that you can look into those things as well. Links
Okay.
and okay. Thank you very much. See you guys tomorrow. Take care. Bye-bye.
Bye, ma'am. Thank you.
Thank you, ma'am.